Victoria Hall is veterinary epidemiologist and the executive director of the Raptor Center here at the University of Minnesota. She leads the center's education, veterinary medicine, and research efforts on both raptors, as well as larger ecosystem health topics. She comes from a One Health background addressing complex global challenges at the intersection of human, animal, and environmental health with organizations including the Center for Disease Control and Prevention, Food and Agriculture Organization of the UN, and the Smithsonian Institute. Victoria.
Awesome. Hello, everyone. It is a pleasure once again to be with this community. So since March of 2022, the Raptor Center, like so many other wildlife organizations or entities, has been in an active response for an unprecedented outbreak of highly pathogenic avian influenza virus. The Raptor Center, located here on the St. Paul campus of the University of Minnesota, is one of the busiest raptor centers in the world. So we see over 1,000 ill and injured or orphaned raptors every year. In addition, we conduct over 1,200 education and outreach programs. We train those future generations of wildlife veterinarians and rehabilitators, and we conduct ecosystem health research. With every single patient that comes through our doors, we have a chance to learn a little bit more about what's happening in that ecosystem that they come from. Highly pathogenic avian influenza certainly did just that. So today, during our time together, I'm going to tell you this story, the story of what has happened this past year at the Raptor Center. I'm going to give you a one-slide background in case you didn't hear my colleague, Dr. Ladoniki, earlier in the spring talk about avian influenza. We'll talk about TRC's response, and we'll talk about what next, because this outbreak is definitely still ongoing. So, the fast and furious avian influenza. 90 to 100% mortality in domestic poultry and raptor species. So very substantial to an organization like the Raptor Center. It's often carried asymptomatically by waterfowl, shorebirds, and seabirds, often because this strain acted a little bit differently. Now, these birds are able to move all around the world. They migrate, they change, they mutate their flus together, they share them, they mix them up. And this is why avian influenza is something that we're always going to have in wild bird populations. It's very easy to transfer this virus from one location to another via fomites. So fomites are objects contaminated with virus. It's globally reportable to the World Organization for Animal Health and has major trade implications for agriculture. Because it has such big trade implications, USDA has a very severe response to it. And when poultry facilities are positive, they go in and they use culling or stamping it out, where they depopulate all the birds. It is a zoonotic disease, so while it's rare, it can go from animal to people. The last outbreak in Minnesota happened 2014-2015. This was a major outbreak. We were the top state in the country. We had 109 domestic poultry facilities affected. 8.8 billion domestic birds were culled during this outbreak. We tested every single raptor at the Raptor Center, and we had 0 positives, which is very different than this current outbreak. WRC had 1 PCR positive of a black-capped chickadee. So this outbreak, it's an H5N1 highly pathogenic avian influenza virus. It belongs to clade 2.3.4.4, to be specific. So every strain in viruses can do different things, right? So this strain began circulating in Europe in October of 2020. It immediately looked very different because it was in so many more wild birds. It also showed up season after season after season, which is also different for these outbreaks. It was first detected in North America in December of 2021 in the domestic flocks in Newfoundland and Labrador, Canada. So these birds were believed to have been exposed to the virus by migratory waterfowl that came from Europe. The virus then traveled right down the East Coast, was detected in North and South Carolina in early January 2022. It continued to spread to other states along the Atlantic Flyway. It reached Florida at the southern end, and at that point, New Hampshire to the north. And then it began moving. It moved northwest across the country. It entered multiple migratory flyways, and it moved very quickly. So we saw it in Kentucky in February, Kansas, Indiana, Iowa, Nebraska in early March, South Dakota, March 18th, and the end of March, North Dakota and Colorado. So we in Minnesota were just waiting, right? It was sitting in all our neighbors. We just hadn't found it yet. We knew it was here. So in the preparation process, we needed to identify our goals and our objectives as we moved into this outbreak. From a daily operations perspective, we wanted to be able to stay open. for wild bird admissions. But we also needed to contain this highly infectious and zoonotic foreign animal disease, right? And not accidentally spread it to our other patients, our education ambassador birds, and also to protect our people. So a lot of facilities across the country closed to accepting raptors, or they went to euthanasia only during times of surging. When we thought about the big picture of what we do at the Raptor Center, the work allows us to get a unique opportunity to look at what's going on in our local wildlife populations via each patient that comes see us. We recognize this is a biased sample, right? All of our patients are ill or injured, but we can still glean a lot. We wanted to do our best to advance science and knowledge about what was going on with highly pathogenic avian influenza. And we wanted to work with our agriculture and public health colleagues so that together we could have a whole ecosystem health picture of what this virus was doing. In order to meet our day-to-day objectives of staying open and protecting our wild and captive birds, we needed to repurpose an entirely new biosecure quarantine building from the ground up in a matter of days and develop all new protocols, right, to deal with this specific virus. So this is the building we ended up using as our quarantine facility that's still in use right now. And at the Raptor Center, we have close to 30 education ambassador birds housed in the same building where we conduct our wildlife rehab activities. So the education birds are located on the main level of our building. And you can see this over to the right side, and their enclosures are on the right with the arrow. The wild rehab birds are located in the basement of the building, and their pens are that middle arrow. And then our triage and quarantine building was across the parking lot with that left arrow. So our risk tolerance was extremely low. Remember, 90 to 100% fatal. If this virus was able to move from our triage and primary quarantine building across the parking lot to our main center building, the results could be devastating. So if we were gonna stay open and continue to admit wild birds that we knew had a high chance of being infected by the virus, we needed to get our protocols right. We were very fortunate to collaborate with the Minnesota Department of Health, who came and did just-in-time biosecurity training for us. It is a lot harder to put PPE on and take it off appropriately than it looks. We did our just-in-time Tyvek buying at Home Depot the night before our first positive. If you ever want to get weird looks at Home Depot, roll around like that. And then again, it's really hard to put this stuff on and take it off, and this virus is so infectious and it's so easy to spread. So we had the health department come back as we were starting to build out this building, and that's our medical director, Dr. Dana, working on how do we safely put it on and take it off. And nothing like just-in-time facility work. So many things are unknown right now about dealing with wildlife rehab centers with virus. So we are actually working on a research project where we use landscape fabric to help make different quarantine pods. So it doesn't filter out the virus, but it disrupts the airflow enough that it stops transmission, is the hypothesis. So we were doing environmental sampling of these fabrics the whole time we had birds. Seemed to work so far. And we worked through the rest of our flow of the quarantine building, where we triage, store supplies, quarantine birds, deal with dirty crates, which was a lot harder than it seemed. And these birds were housed in quarantine pods because we didn't know much about the incubation period, right? People don't do challenge studies of bald eagles with highly pathogenic avian influenza. So we had some science, but it was really, we were flying blind with how long it could be incubated, what signs they see, can they carry it without showing signs? So we used a huge amount of testing. So we were privileged to work with the Pomeroy Lab, which is a huge avian influenza focused lab and poultry lab, as well as the Veterinary Diagnostic Lab. During the peak of high path transmission, we discontinued our flight reconditioning. We reconditioned our birds with creance lines that are attached to the birds. These fields became populated with ducks and geese, so we stopped flying birds at that time. And once we started again, we used a lot of biosecurity protocols. And if you come to the Raptor Center today, you're still gonna see stuff because this outbreak goes on. Foot mats, changing shoes, foot covers, things like that to make sure that people aren't accidentally bringing this virus in. So beginning on March 28th, all wild raptors that presented to the Raptor Center for rehab were PCR tested on admission. We tested both alive and dead birds because we know that this virus is so fatal. We could also glean a lot from birds that had died, right? And tracking where we're seeing transmission. And then it arrived. HPAI arrived at the Raptor Center on March 28th, 2022. So this was only days after the first confirmed positive poultry facility in the state. And what we've learned is that raptors are a really good indicator for where virus is going that can better help our agriculture colleagues as well understand risk in the environment. So our first PCR positive bird was a nestling great horned owl from Dakota County that was found on the ground. This chick, unfortunately, was unable to stand and was having active seizures when it came to the Raptor Center, and ultimately died from the virus. This virus has been severe, and it's been severe on our volunteers, and it's been severe on our staff. We have seen an unprecedented amount. We have only had one bird survive it, to the point they could go back to the wild. So most of the birds that are coming in are very, very sick. I had volunteers going out and picking up 2 great horned babies, and before they even could get to us, they were going back for another one in both parents, right? So this is how severe this virus was. So I wanted to share with this group just a little bit of an insight into our triage building. So I've got 3 just really short video clips of what this looks like. These are very sick birds, so I just wanted to give a warning. But I wanted to give you just a little bit of glimmer of what we are working on 7 days a week for months at a time. Go back. So this is an adult bald eagle that came into our care. So this virus attacks the nervous system. So it really messes with their brains and the nerves going to their eyes. Sometimes they're fine when you first see them, and as soon as you stimulate them, they go into seizures. So this bald eagle is having a seizure. He had very poor eyesight too. Oftentimes they're blind. Now the challenge with bald eagles as well is 80 to 90% of the bald eagles that we see at the Raptor Center have some level of lead in their blood, right? 20 to 30% have a toxic level. So we also had eagles that were coming in with lead poisoning as well as highly pathogenic avian influenza virus. We know from postmortem examination studies that there are massive brain changes that most likely would never allow this bird to go back to the wild, even if it could survive the virus. The most common bird we saw were great horned owls, which were in the media quite a bit. And again, you can see just uncontrollable neurological symptoms. We filmed all these birds because facilities around the country had never seen this before. So we became a resource for the community on what this virus actually looked like so we could better treat. Now, sometimes the end stages of the virus were much more subtle, right? So this is a bird that was severely affected, a red-tailed hawk, and instead of having those huge outward seizing signs, was just virtually non-responsive. And this is a wild bird. He shouldn't be fluffed out. At the end of the video, he actually foot tucks with us. Even if we support that bird, because we've tried with a number of them, they never recover. They've got permanent changes. So that's the end of the videos if you were looking away. We're trying to glean every little bit we can, right? Because we saw hundreds of birds like that. And we knew that in the middle of all this just extremely emotional work, we wanted to learn things so we can better help and better inform. So we did a postmortem study where we got 6 of multiple species of birds and did necropsies right after death. This is a slice of brain from a great horned owl, severely affected, and it's immunohistochemistry section. All the dark stuff is virus. So if you're talking about impact on the brain, you can see big picture there, that they're severely affected. So now to go to the numbers. So I like to start with what the birds look like because then the numbers take on a different meaning, right? So this is our graph. I'm sorry it's gotten so small. We didn't expect when this started for this to go on this long. But you can see the trends pretty darn easily. So this was the spring surge. And when it came back, it hit Minnesota with a fury. Our peak week was the last week of April, where we saw 43 positive patients in just 1 week. We were seeing 3 to 4 times as many birds as normal, and all these birds were admitted in our triage building in full Tyveks and respirators, gloves, biosecurity. So it took some monumentous effort. Calm down during the summer, which is what we had hoped for, right? Migratory birds move on, the temperatures get hotter, birds disperse and go on nests. So we had a much quieter summer, which everyone welcomed. But then as soon as migration started this fall, we started seeing numbers again. Now, not nearly as much, which is fantastic, but this virus is so darn infectious, 1 positive bird getting in our hospital, right, could devastate it. So we still have the same amount of biosecurity stood up at the Raptor Center. Now, the good news is we just got confirmation the last 3 weeks we've not had a case, but there have been some cases in non-raptor species lately too. So it's still here, but we're hoping for a quiet winter. Looking at different infections with different species, we had a huge range of different species, but we'll zoom in on those top 6 that we receive at the Raptor Center. Of our great horned owls that we received from March 28th to September 11th, 52% of our great horned owls were flu positive, 25% of our red-tailed hawks, 5% of our Cooper's hawks, 46% of the bald eagles that presented for care at the Raptor Center were flu positive, 2% of our broadwings, and 14% of our barred owls. So really, really strong impacts, especially on our bald eagles and our great horns. Now, we did have some unexpected species test HPAI positive. This included a rough-legged hawk, a northern harrier, and an American kestrel. These are species that do not typically ingest waterfowl or shorebirds, and rough-leggeds and kestrels are not typically found in those marshy or wet areas. So just interesting species that we wouldn't have pegged as high risk for exposure. So this map from the USGS website, though, shows where we sit as a country, and it goes into Canada as of November 27th. This map only represents birds that have been tested primarily by state and federal agencies. So it doesn't include wild birds under any sort of human care. So that means it doesn't include our wildlife rehab patients that we test immediately as they come in from the wild. So it's a pretty substantial map, and you know this is an underrepresentation. There's been HPAI detections in commercial poultry flocks, which are the red dots, in backyard poultry flocks, which are the yellow, wild birds, which are the green, and wild mammals, which are blue, which has started to become just a very, very interesting amounts of transmission. It shows with each strain and each outbreak, there are different things happening in different species, different transmission patterns, and everything we knew from the last outbreak sometimes may or may not be relevant for this one. There's been a large amount of disease transmission in our region and in the upper Midwest in wildlife, commercial, and backyard flocks. So next, we'll bring the conversation just back to the big picture, discuss what we're planning to do next. So why do we do all this, right? Why did we go through this tremendous amount of effort and expense? Because this came with a huge amount of expense to be able to still function at this level. We had enormous help from emergency fundraising too, which I know many in this room contributed to, so we just want to give our heartfelt thanks that we were able to maintain operations because of you. And this changed pretty much all of our day-to-day operations ever since the end of March. The first reason is for the individual animal. So we did this because we were having a massive outbreak in our region, and we were presented with numerous individuals that were suffering, right? You saw the videos, suffering from these severe clinical signs, and they needed our help. We wanted to stay open not just to help that individual bird, but to help people too, because the last thing we wanted were for people to bring these birds into their homes and potentially expose their birds at home or their families as well. We were also able to take deceased raptors in, which also lessened the chance that something could scavenge on it and then catch the virus from scavenging on a bird that had died from the virus. And then there were birds that we could still help. Right? There were birds with conservative fractures or orphan birds. That's a great horned owl baby that we got to foster to another nest, right? So we wanted to keep helping the birds that we could help. The second reason was to learn. We were faced with this huge, unprecedented outbreak of this virus. Historically, we've known a lot about it, but this time it was presenting very, very differently. And we're in the position with our hands on all these birds that we can collect a lot of data and scientific information to better inform our colleagues, to better inform responses. And we've been able to share these on a global level, consulting across the world with captive facilities about best practices. Lots of papers underway, as well as more data analysis to come. And the third reason was disease surveillance. Many state wildlife agencies quickly reached their testing capacity, right? And the biggest question with wildlife is, what wildlife population effect is this gonna have, right? And how can we model that? And the best way we can model is the better the data that we have. What large-scale impact do we have? Anytime we lose a breeding pair and all their young in one go, which happened quite a number of times, it makes you start to question. So we really want to contribute to data. We wanted to contribute to disease surveillance. We were able to identify birds that were positive that were found on domestic poultry facilities, that were found in people's backyard chicken coops, so responses could be done. And also people exposures, like a group of little preschoolers who were cuddling a seizing owl at one point. So we were able to help connect public health to agriculture, right, to wildlife, to do that ecosystem health approach. Now the future, as I mentioned, this is ongoing. So we haven't seen a case in a few weeks, and we are jumping up and down with excitement. We are hoping and crossing our fingers for a very calm winter. Our colleagues down in the south, we were just talking to Auburn, has flu in their area now, right? Because we're following the migratory bird paths. Historically, we don't see this pop up season after season. We know in the UK they are, and we expect to see it here. So now we're moving into more long-term thinking about how we handle this. The animal facility we converted to a triage barn doesn't quite work long-term, so trying to figure out what is this new normal we're in. That phrase is used a lot, right, these days. And then also, what other science? So we see a biased population. We see birds that are, ill enough for someone to pick up and put in a box. We have a hypothesis. There's probably more raptors out there surviving this than we know about, right, that never got to us. So we're doing a serosurvey where we're looking for evidence of past infection where they survived. So we're doing it on all our birds at the Raptor Center that come in for non-flu reasons. And then we're also partnering with an amazing team at Hawk Ridge to collect samples from truly wild birds to see, because we bet and we hope, right, that there's more survival happening than we think. So I'd like to thank everybody for the opportunity to be here today, and thanks for listening about what we've seen at the Raptor Center.
I see some hands shooting up, so let's answer some questions here.
Steve Weston, your map, was that more a map of what facilities were testing than a map of where the bird disease was?
Like the map of the whole country?
Yes.
Oh, so that was the official USGS map, and I can go back to it. So that is the official map of what mostly state and federal governments have found with their testing. But it's kind of the biggest picture, most in depth. Our cases are actually not on that map because we're a rehab facility. I don't think so.
Any suggestions for safety?
Absolutely. And so it gets sticky with flu, right? Because we have so many species of birds. And I'm an epidemiologist and I love data, right? And this virus can act very differently in different species of birds. So the risk to one species might be very different than the risk of another. So for something like banding of raptors, right, I would be at a much heightened awareness for risk, especially during times of transmission, so times of migration. So trying to make sure that we're first, right, doing no harm, and that we are not accidentally transmitting contaminated materials from one bird to another. So we do a lot of spraying off our handling gloves with a disinfectant that can kill avian flu, wiping down other materials, potentially changing out different bags if you're using bags. So really, it's a risk-based approach on what species you're working with to band, and then what level of mitigation do you need, and then you compare that to what level of transmission. Now, we've got a whole lot of birds that aren't routinely tested, and some of the small birds especially are in that batch. So what is the risk and what are the implications are things that are still great scientific questions to fully understand. And how much precaution do you want to take for each one then becomes a judgment call.
George Vinny just asking, for us that are feeding birds, should we do this in a cycle, like when you showed those two peaks? Should we avoid feeding during those times, or what would you recommend?
Yeah, so feeding birds has been the topic of the spring, right? There is a poultry veterinarian who's a global expert on AI named Carol Cardona, and she says a line I like. She says, "We know everything about avian influenza until the next outbreak starts, and then we know nothing again." Right? So this is an influenza A virus. It mutates, strains do different things. So at the beginning of the spring, we were seeing just such unprecedented transmission, right? And at the Raptor Center, we like to do no harm to a strong precautionary level. You saw those great horns, right, and the eagle. So I think at some point, abundances of cautions are worth considering for people to make sure that we as people aren't playing a role bringing birds together. Definitely when the risk is lower. Probably not warranted. And what this virus does in different birds, like songbirds, again, still interesting things to study. So a whole lot of songbird species, not a whole lot, but a number of songbird species have shown up positive for this virus. What role are they playing? What risk are they? What risk are they to the great horned owl that you love in your backyard? Those are the questions to be had. So if you were considering doing things like pausing feeding birds, definitely doing it with the high-risk times. Because with the low-risk times, it's probably just fine.
I'm Jeannie Kant. And you mentioned a couple times that this version presented differently. Are you talking about the volume of it, the range of species, or what other factors made it different?
That is a phenomenal question that we can epi-nerd out on. So historically what we've seen, so I showed at the very beginning, right? We had 0 cases when we tested every bird in 2015 in wild birds. So every avian influenza outbreak starts with a wild bird, right? They maintain it in the environment. And for some reason, somehow it becomes a high-path strain and it somehow gets in a poultry facility. And usually what happens then is people or equipment or cars move it poultry facility to poultry facility, right? And you can almost trace the feed truck, which is pretty substantial. And then it usually doesn't come back the next season, right? So USDA comes in, they stamp it out, they clean, they disinfect, they know how to do that very well, and they can batten it down. This outbreak is across the entire country. It is in massive quantities of wild birds. It is in more backyard flocks than ever before, which further indicates that probably wild birds are bringing it in more. And we're not seeing that classic pattern of facility to facility, where it looks like it's a new introduction from a wild bird at most of the facilities. So the wildlife component of this is substantially different than what we've seen before.
John Moriarty with Three Rivers Park District. I do the Eagle survey for the Park Service through the Twin Cities, and I was seeing dead eagles on nests. How long can a bird be dead that you can still test it? And also, how long is that nest considered contaminated if another bird comes in to use it?
Yeah, that's a great question. It depends a lot on the different weather conditions. Moist and cooler environments, it's going to last much longer than those really hot days. When it gets really, really cold, it'll die. When it's just a little bit cold, we say refrigerator temperature is the way it likes the most. We've had success testing birds that were quite dead. And we've also gotten environmental contamination positives from like great horned owl nests a couple weeks after we received birds from those nests. So it does seem like you can test for quite some time. How long that nest is a risk to others is a great question that I don't think we have the great data on. That's why we did encourage when dead birds were found in the environment for them to come in so that we could dispose of them, because we just wanted to get as much out of the environment as we can.
And we've got our last question over here, Victoria.
Hi, I'm Claudia Egelhoff. My background is public health, and I've heard from a public health colleague whose expertise is respiratory health that she believes that HPAI is an airborne disease, and that it's getting into poultry houses because it's being blown through the air. I mean, the wind is carrying it from the ducts nearby. And she thinks all these precautions with trucks and people's feet and all that kind of stuff is really irrelevant because it's airborne. Is that, is she off base there?
No, it definitely has an airborne component, right? And especially when we think about commercial, like poultry houses where you have a mass number of individuals in one small airspace, right? Definitely can drive it. We know we've done a lot of environmental sampling around our practices, mostly to see how we were doing biosecurity-wise. And fomites are a really, really major driver of transmission as well, though. So we can find that we can spread it through objects, and there have been broad epi studies of past outbreaks where they have found, using the genetic sequencing, right, they've been able to trace it basically on trucks and vehicles. So there's definitely a very strong component of that. As far as airborne, we have had cases where we've had birds in quarantine pods where one came up positive and was sitting next to another, and we did not see transmission there. So again, every virus strain changes and does a little differently. This one doesn't really seem to be having a main driver from an airborne perspective. Certainly can, but we do think that it's probably more fomite transmission with this one. But influenza A's can go through all sorts of species. I mean, we've got dolphins and seals getting this right now. This is just a very, very fascinating outbreak from an epi standpoint.
Excellent.
Thank you, everyone.
Thank you, Victoria.